Welcome. Today we are looking at diabetes mellitus, types and causes. Diabetes mellitus is found in almost every population. Diabetes is recognized as a group of heterogeneous disorders with the common elements of hyperglycemia and glucose intolerance due to insulin deficiency, impaired effectiveness of insulin action, or both. Diabetes is now one of the most common non-communicable diseases globally. Diabetes is found in virtually every developed society, and it is ranked among the leading cause of blindness and renal failure globally. It is the fourth or fifth leading cause of death in most developed countries and is now an epidemic in many developing countries. The incidence of people living with diabetics will increase to 6.3% by 2025. People living with impaired glucose tolerance are expected to reach 472 million by 2025. And type 2 diabetes constitutes about 85 to 95% of all diabetics developed in developed countries and industries. It is now a global health problem. There are many complications of diabetes, such as coronary artery, peripheral vascular disease, stroke, diabetic neuropathy, amputation, renal failure, and blindness, resulting in increasing disability, reduced life expectancy, and enormous health costs for virtually every society. Diabetes is certainly one of the most challenging health problems in these times. Impaired glucose tolerance is a symptomatic condition defined by elevated, though not diabetic, levels of blood glucose 2 hours after a 75-gram oral glucose challenge. Although with impaired fasting glucose, it is now recognized as being a stage in the transition from normality to diabetes. Thus, individuals with impaired glucose tolerance are at a high risk of progressing to type 2 diabetes, although such progression is not inevitable, and probably over 30% of the individual with impaired glucose tolerance will return to normal glucose tolerance over a period of several years. Diabetes is classified on the basis of its etiology and clinical presentation of the disorder. There are 3 types of diabetes. We have the type 1 diabetes, the type 2 diabetes, and gestational diabetes. Type 1 diabetes results from cellular-mediated autoimmune destruction of pancreatic islands beta cells, causing the loss of insulin production. It ranks as the most common chronic childhood disease in developed nations, but it occurs at all stages and the clinical presentation can vary with age. Type 2 diabetes is characterized by insulin resistance and relative insulin deficiency. The diagnosis of type 2 diabetes usually occurs at the age of 40, even though the age of onset is often a decade earlier in populations with high diabetes prevalence. Type 2 diabetes can remain asymptomatic for many years, and the diagnosis is often made from associated complications or incidentally through an abdominal blood or urine glucose test. Type 2 diabetes is often but not always associated with obesity, which can cause insulin resistance and lead to an elevated blood sugar levels. People with type 2 diabetes are usually not dependent on exogenous insulin and are not ketosis prone, but may require insulin for control of hyperglycemia if this is not achieved with diet alone or with other oral hypoglycemic agents. Gestational diabetes mellitus is carbohydrate intolerance of varying degrees of severity with onset or first recognition during pregnancy. Gestational diabetes mellitus is increasing globally in concert with the worldwide rise in the type of diabetes. What are the causes the common factors that are found to cause diabetes mellitus. Overweight or low level of physical inactivity are increasing the risk of type 2 diabetes. According to World Health Organization, 85% of the global burden of diabetes and 21% of ischemic heart diseases and 42% of certain cancers are attributable to body mass index above 21. Physical inactivity is related to diabetes risk, both directly as a result of its effect of insulin sensitivity, but also indirectly via obesity. And World Health Report estimates that 11 to 24% of people are currently physically inactive. WHO estimated that a modest 25% reduction of current and future obesity and physical inactivity could lead to avoiding 1/2 or 1/3 of the burden attributed to the respective health factors. So we see that when you are obese or you are overweight, when you live a sedentary life, there is no activity, even common activities such as walking, jogging, and then unhealthy eating lifestyle also is a risk factor for this. And for people that are smoking, it also predisposes them to having type 2 diabetes. How can it be managed? It can be managed by losing at least 5% of your body weight. Because when you lose 5% of the body weight, there are improvements in your glycemic index, improvements in some of the health factors or health indices that comes with diabetes. And then being physically active, at least doing 150 minutes of moderate exercise or 75 minutes of vigorous exercise weekly, that will keep you burning weight. And then making a healthy lifestyle change. What does this mean? It means doing away with unhealthy eating, doing away with food that you are not meant to eat, and going towards eating plant-based diets that will fuel you with fiber, cruciferous vegetables, and fruits that are good for you. It means returning back to nature and eating more whole foods and doing away with fried foods, doing away with foods that are high in flour, high in sugar, eliminating added sugar from your diet, eliminating high fat from your diet. This will help you. If you like our videos, kindly subscribe, turn on the notification bell so that you get our videos as they drop. And you can visit us in healthiswealthy.com to learn more about this.